Hey guys, it's me. Are you getting tired of me yet? I know I can be very talkative and I tend to go on and I'm sorry about that. Also, out of nowhere today I start feeling sick, coughing a little bit, and now my voice is a little off. So I'm very sorry that you have to sit through that. I have so many notes. I say the same thing every time, but I have so many notes, which is good because, and I've written them over the years. I've written them this week, last week, and I think it's good that I keep track of this stuff. Um, so this is going to be a little bit of everything in this video. And does anybody else like Marvel? Whose shirt is this? Somebody in the comments, even if only one person watches this, or you don't even watch it long enough, if you see this, tell me what it represents in Marvel. Okay, so I wanted to talk about sort of like medications. I'm a little reluctant about talking about medications. I don't really want to give names out and stuff. So as far as I'm concerned, on my end, I'm going to be very careful because I don't want them to strike the video or anything. So let me just read what I wrote. Let's talk about, and I'm going to look down at my notes, okay, and drink water in between because I have a terrible dry mouth. So I wrote, let's talk about, oh my goodness, guys, some of my writing is so bad. Okay, let's talk about taking medications. This is a very taboo topic, so I'm going to be very careful what I share in regards to my pain regimen, my mental health medicines, and some of the pain cocktails that I received in the ER a few times. They don't like giving pain medicine, but I forget what the cocktail is. I think they mix 2 or 3 things together when you're in severe pain. I always thought that when they gave me pain medicine, if I didn't ask for it, like at the ER, and I guess they would just tell the nurse, go put something in her IV. I always say they experimented on me. I feel like I've been experimented on for 13 years, but again, I can't do blame game. I have to accept that. That's something I'm working on. Okay, so let me see if I can read my own handwriting. So, yeah, that's an extreme word, experimented. So anyways, as I've said in other videos, I would do anything my pain clinic recommended, my mental health office, my PCP, my endocrinologist. I'm always willing to do things recommended by my pain management clinic. And I've talked about how we didn't exactly see eye to eye when I got my newest pain management doctor. He's been my doctor now for 7 or 8 years, but he's reduced medications, changed things. But here's what I will say: I wear a patch. Okay, it's not a morphine patch. It's nothing that makes me high. It's nothing that gives me energy. I mean, you can do your own research online and look up pain management patches. I wear them every day. Every 7 days, I take one off, and then I replace it with another one until the box is completed. So it's 4 weeks worth of patches. And it's for people like me that have pain around the clock. So, I mean, I was a perfect candidate. My only fear now is, since my pain is getting worse and those injections didn't help, I'm worried that either my doctor won't want to increase me, because there's one level up, I think, it's like 5 milligrams or whatever higher, and there's nowhere to go from there. So I think if I even mention it, he's going to think, well, Lori, what happens if you reached your peak? What are we going to do then? So, I don't know. He might be flexible with me. It's been so many years. He knows me well. He trusts me. I've never failed a drug test. I've never failed to do what I need to do. Um, so yeah, I mean, I wear a patch that they prescribe. I've been on it for about 6 or 7 years. I was on one dose lower and I'm on one higher. So just do your research. Look up patches. It's not morphine or anything like that. That I would be like, oh my god, I feel so relaxed. No, I'm still in severe pain. I have my heating pad on me right now in the basement. This is my office until I see what the future holds. I mean, I actually like doing this. I didn't think I'd get comfortable talking and staring at myself. Um, but I think because I'm isolated down here and it's quiet and, you know, my kids are older anyways, um, I have enough privacy. My youngest is 16, and I told him if I'm talking and I'm on a video, don't come down here. And I said, if you don't hear me talking, if I have music on or you don't hear me at all, put the light on so I know you're coming down. Anyways, that's irrelevant. Alright, so I'm on a patch, and I'm also on 2 medications. One is a very low dose muscle relaxer. I really can't even tell you if it helps or hurts me. You know, I really don't know. And I tell them that. I say, it's not hurting me. It could be helping me and I don't realize it. So, and it's a very, it's, I don't even know if it's considered like class, whatever, ABC 1, 2, 3. So I'm on that. And then another one. And I'll just say it because it's not a narcotic. It's gabapentin, Neurontin. That's a one generic version of the other. This pill, I do not like it. I do not like it. But for years, I refused to take it because I did try it out, and I just felt like I was in a twilight zone. I did not like how it made me feel. Eventually, my doctor brought it up. You know, he would keep bringing it up. I'd say, I'm just, you know, he'd say, let's start at 100. I mean, the bigger ones are 600. So he'd say, okay, well, how about we start at 100 twice or whatever a day. This was years ago. And I took his advice because I was desperate. And I didn't think it would help. And it does help. Tremendously? No. Oh, no. I get headaches as soon as I take one. And I have no idea why. Yes, I do have chronic migraines and headaches. But this pill is supposed to be for people that have brain injuries. So I don't understand why I get headaches, but they mostly get prescribed to a lot of head injuries. And I've been on that for a couple of years. So I'm not going to say the dose, but I'm on it 3 times a day. I take a pill, okay? And so that with the muscle relaxer and the patch, I feel like I am getting a little immune to the patch, but I don't know what he'll say, you know. I don't know what he'll say about bringing it up, you know, the dosage. Alright, let me see. A cocktail. Okay, I always do what they recommend. Sorry. I write so fast. I wrote something about the ER, you know. They'd give me Dilaudid. I think I talked about that already. And then come back in and say, nothing's wrong. You're being released. Bye. Again, sorry for my voice. I have a list. And honestly, everything I'm doing is talking about me, and I really don't like it. It's only for anybody that can take something away from the video. Something they didn't know before. Or even the gabapentin. A lot of people are on that, and it's because the FDA is coming down hard on our doctors, especially pain clinics too, because they think some people are faking pain to get drugs. And so again, me on paper, I look like there's nothing wrong with me. But if they dig deep and go back all the years and all the things I've been through, I think if my pain management doctor wanted to put me on something stronger, I think he's concerned with the insurance companies too. I have a really good insurance plan. I don't think they would deny me. If they did deny me and they and my doctor wrote a note, I think they would change their mind. I'm pretty sure for the when I had the spinal cord stimulator, it was at least 100,000 because I seen the receipt somewhere yesterday. I want to say 200,000, but that seems a little high. But it's medical. It's a huge surgery. I mean, I know I talk about the spinal cord stimulator a lot in my chronic pain too, but it goes back really to 2012. I was on the internet seeking anybody that could guide me or help me, or I wanted answers before the surgery. That way I knew what to expect. Because you know how it is when you're going in for a procedure or something. They call your name, you go in there, everybody's in a hurry. Oh, I'm the anesthesiologist. I'm Nurse Barb. I'm taking my glass off. I don't know who A, B, C, E, F, G is. And so they're so in a hurry, there's no time for like questions. So I'm one of those people that likes to think ahead. I'm a planner. Yes, I do some things spontaneously, but I like things to be in order. I'm the one that shows up a half hour to doctor appointments, you know, because in my head, and this goes back to mental health, in my head I'm thinking, well, there could be an accident, the traffic could be backed up, and I don't want to go in late. I'm pretty sure I've never missed a doctor's appointment in the last 30 years, but I am early. Told you this was going to be all over the place. Because the title was, let's talk about how we get treated. Alright, so since we're talking about medications, I'm gonna try to be conservative about my other doctors. So I pretty much give you a rundown of my pain clinic. The patch is the main painkiller. And I never understood how a patch could help you, but I guess it absorbs through your arm. But I still don't understand, how does a medicine, it's not a living being, how does a medicine know to release like a little bit of medicine through your skin, or is it constantly going on? I think about everything, guys. I do. I like to have answers. Okay, so let's go to my PCP. I don't mind talking about this. I have a good group there too. I was seeing them a lot because in 2017, when I first started seeing them, and I love this group too, 2017 I was diagnosed with diabetes type 2. I couldn't believe it. But on the other hand, after I did accept it, I did believe it because my mother had diabetes. Her siblings had diabetes. Her mother had diabetes. And so it scared me. I couldn't believe it. Because before I was diagnosed in early 2017, I had different symptoms, like weird, I really don't want to get into the symptoms, look them up. Just, there was weird side effects, and I was scared. So when I finally, I don't remember, it was a medicine. It was a medicine that can cause infections. I'm going to leave it at that. And I don't know how I figured that out, but I figured it out, not the doctor. Okay, so when I started in that office, 2017, 6 years ago, right? 1890. I'm just like a child. the first, the first thing they give is a metformin. So I was on 2 500s twice a day, I believe. Glipizide. I can't remember the dose. Probably, even 10, or some medicines, if they have low numbers, it doesn't mean anything. It means that they're getting higher as they go on. So I was on metformin, glipizide. I was also on Humalog and Lantus. Lantus was first. That's the one that you, every day at the same time, either morning or night, you inject yourself. I started out at 3. I remember thinking, how is that going to help? And so I had a very hard time controlling my diabetes. Uh, I tried dieting. I was doing all kind of different shakes and everything. I wasn't exercising a lot, I will say that, but I just didn't know what to do. Like, they kept wanting me to meet with a diabetic educator, and I had already done that. So, but they were so persistent because I know what diabetes is. I know what I needed to do, but I just wasn't in that state of mind where I cared enough, because again, I have terrible depression. A lot of people wouldn't even know that. I mean, a lot of people hide this stuff. When I meet somebody, I don't know if what's in his medicines, but I also don't judge people. So, I think I ended up in the hospital one time. The ambulance had to pick me up because my blood sugar was so high. Um, and it's funny because I remember when they came in, I was able to walk. It wasn't 1,000, and they brought in a chair instead of it was like this yellow chair, little chair. I, I don't know why it was so funny. It was funny? When you left my house, this is my old house, you leave my house and then you go up 4 or 5 steps and they put me in this chair. And it was like bumpity, 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 bumpity. And I remember thinking, I hope my neighbors can't see this. And so, so in the hospital, um, they helped maintain my diabetes and bring it down, and also treated me with pain medication because I was entitled to that. I would be taking it at home anyways. And so, yeah, there was only a few times that I went to the ER um, for the chronic pain, not diabetes. That was the first and hopefully the last. So I can't remember how many times I went to the ER. I went to different hospitals. I'll never do that again. That's how naive I am. I didn't know that people that know about doctor shopping, that's exactly what I was doing, but I didn't know it. I just wanted help. That's all. Okay. So the metformin, I was on that, the glipizide, and then I was testing myself. Oh God, is that a pain in the ass? Doing those strips, testing yourself. Um, and then, so when I left the hospital, I think she bumped up the numbers on the Lantus. Sorry, because that's just the Lantus is the slow acting insulin. It's not going to hit you once. Now the other one that I eventually, not right away, eventually they added because my diabetes was so out of control. And even I couldn't figure out. I mean, I knew I wasn't running around town, but I was still, every day I try to move my body. Mornings are hell, okay? It's so hard to get out of bed. It's so hard. But I know I need to move my body. And I have to go to the bathroom. But mornings, I just feel like this isn't fair. I hate feeling sorry for myself. I don't typically do that. But you get to a place, a bad place in your mental health, and you start thinking about all the things you missed out on, all the maybe weddings, maybe christenings, probably saying that wrong, anything socializing. And I have social anxiety anyways, but I can still have conversations, but inside my heart's racing. It's just how it is. Anxiety, people that have anxiety, everybody has a different level, low, high, and so certain things are very hard for me, but I try to hide it. I'm decent to people. That's the thing. I don't need to advertise to somebody that oh, I'm in a pain clinic. I go to my PCP. I have a mental health office. I have an endocrinologist. Okay, so look, I'm still talking about PCP. All right, so right now, as of right now, I've not seen them since last year. I am going to call them for an appointment, which they're probably going to be shocked because they're the ones always trying to get me to come in for my annual exam. But the reason I want to see them is because I'm having balance issues. Like I'll get up out of bed, and I'm the type that gets up and goes fast. Like I don't get up slow. It's just how I am. I do things fast, and there's times I can't count how many times that I've almost really gotten hurt. I catch myself. So I am worried about balance issues and also getting lightheaded at times. And what I'm wondering about the lightheadedness, you stand up, you're like, oh my God, whoa. I'm wondering if my blood pressure is low. So I need to know if I should stop taking the propranolol, because if it's lowering my not blood sugar, my blood pressure, they may have to take it off. And this is good news, okay? Because I'm going to have to wrap around this for a while. I really hope somebody watches this whole video. Because diabetes is a big deal, and, my story, Anyways, after last year, I'll get into that probably in another video. Last year, I had an episodes, okay? It was my son's birthday, and that night I had episodes. The next couple of nights I have episodes, I don't really remember. I passed out. Thank God I didn't hit my head on anything. I don't know why I passed that. And so I tried everything to feel better. I was getting intense stomach pain. I couldn't understand why my stomach hurt. And my sugar was high, or if that's related. I have no idea. I have no idea if there's a connection. After like 3 or 4 days crying, if I cry, it's bad. I was wailing. And my son was in the next room and staying at my house, and he would just beg me, Mom, please go to the hospital. Come on, you know something's wrong. I just had all these memories of all the different doctors at the ER and blah blah blah. But when they see your blood sugar is high, they don't play. You're going, okay? You're going. Whether or not you're gonna get pain medicine if you're hurting real bad, I don't know. But anyways, this was February of last year. It was my son's 16th birthday. Wait a minute, 15th. He just turned 16, sorry. So I'm just so happy that I did get to have the dinner with them. We were going to go bowling, but they had no lanes. So it was a nice day. Went home. I never could have predicted this. Never. I never. So I had stomach issues on top of the diabetes being uncontrollable. And again, I don't know if they were connected. So I go to the hospital, up the bumpity chair, and I said, I can walk, guys. I can walk. I'm not. But they have to do their job. They're thinking, I got this big ass number for your sugar. You're not walking anywhere. Like, this is my job. And I respect that. So they took me to the hospital, and, I went through a bunch of tests again, and, they took me serious. I was having stomach pains while I was there and trying so hard not to cry. I mean, it's almost like you can't win. Should I not cry? Should I try so hard not to cry? Which makes no sense. I know. That's what's in my head. I couldn't take the pain. I was like, oh. I mean, it was bad. And so they did treat me with pain medicine. Probably diluted, whatever, delighted. I don't know how to say it. I never knew about medications before pain management. I had no idea the effect they have on you, and I would hear stories, local people that got addicted to drugs. So, okay, to make a long story short, I got a colonoscopy because I thought maybe my stomach pain was related to something down there, in my bowels or something, and after I had that, the doctor that did it came in my room. I was there for 7 nights, by the way. I was not happy. I was not happy because you don't get sleep. You know that. You don't get nothing. By the time you fall asleep, they're waking your ass up. But they were taking care of me. I will say that. I had amazing care. But 7 days, that tells you a lot. I don't know what numbers they were coming up with. Um, so anyways, I seen the gastro doctor. We did the colonoscopy. That was so painful because at this point I knew something was going up in my stomach because I'm in so much pain, and also my stomach goes hard. And so, of course, they're thinking, "Oh, you're constipated. Can you go to the bathroom?" And I was like, "No." So my stomach wasn't. It was protruding, and it looked like I was pregnant. So the doctor, the um, the the gastro doctor, said I had C. diff. I don't know if you know what C dash diff is. It's kind of like it's some kind of um, it's some kind of, I don't want to say disease. I don't want to say that. I don't know how to put it. He he he. How about this? He determined I had C. diff, which is extremely, extremely. You know what? Not safe for other people to come around you. No, no. We were still in COVID too. Okay, we're still COVID. So, after when all the nurses found out, you know, they had to do this whole procedure. It was contagious. That's a word I couldn't think of. I'm sorry. The C. diff is extremely, um, guys, it's so late. It's so contagious. Okay, so everybody was super scared that they were going to get it from me. All the nurses. I mean, they were all so close to me, anyways, even though we had to wear masks. So once they found out, it was funny because there was a routine they had to do. Okay, they had to come in, and then there was this. I don't know. It looked like a garbage can, but it held like linens, except it was like, you know how doctors wear scrubs. Oh, it was the cheap version of that. You know, almost like a gown when you go to the hospital. So they had to drop everything big off their bodies, head to toe be covered, have a mask, make sure they wash their hands, and I was so embarrassed. You know, first of all, I wasn't happy that I had C. diff because I don't know how I would get something like that, but we're only human. Okay, so I just want to say I was there 7 days. A lot of those days, people were coming in and thinking I had C. diff. I remember a nurse calling somebody saying she doesn't belong on this. She don't belong in this ward. Like I was in. I don't even know if I was in a heart situation. I don't know what kind of room I was in. But I remember hearing her say like, you know, we need to move her, blah blah blah. Especially now she has this. Okay, so here's a spoiler. The day I was about to get released, he came in. He was gonna come in and check on me. And he was in a real big hurry. So my nurse was typing stuff when he came in, and he just looked at the file. You know, it just happened to be my file, the nurse in there, and then him at the same time. Um, so he came in, and the nurse was talking about like C. diff, and he said, "Oh no, she don't have C. diff." What? Are you serious? I was mad because everybody thought I was contagious. I mean, obviously, I didn't want to have C. diff. I mean, I could pass it on to my children, anybody. But I remember thinking, you know what? Let's look at the other side. And I'm very sarcastic, guys. It's just a joke. I was thinking back to all the people, because I was in a different room for one night before I left. I don't know why. I think the pregnant girl nurse that was taking care of me didn't want to be around me, and I kind of don't blame her. She was pregnant, and she heard I had C. diff, but I heard him say she don't have C. diff. You gotta be shitting me. How is a doctor at a renowned hospital saying I have it, then saying I don't? Like I was just mind blown. Okay, it takes me back to 2010 when I had a hysterectomy. Okay, Dr. Ted Lee. He said he did an examination and everything. He determined I had endometriosis, and I was thinking, yes, finally, finally, I know what's wrong with me, and this is only year one. Okay, I never thought this pain was gonna go forever. And so he said, you have endometriosis, and do you agree to have your uterus removed? And I was like on board with anything, just like all the other doctors. So we set it up, had surgery, and I talked about this in my last videos too. And when I woke up for recovery, I knew it didn't work. I knew it wasn't successful. Was I pissed that he diagnosed me with something I didn't have? Yes. Endometriosis is not a joke. So there's another. I'm just trying to say, I respect nurses, doctors, all of them, but they make mistakes, you know, and they're protected so much that I can't just be like, you know what, I'm going to sue him because he took my uterus, he misdiagnosed me, and I'm back to square one again. So there's all these protections, and you know, all the papers we sign and we don't really read them, they're getting protected. So anyways, I just wanted to compare that to 2010 when I got that surgery. So I can't make this up. All right, so let's see. You are in February 2022. That's what I talked about. The patch I'm on. That's pain clinic. Okay, so let me go to my psychiatrist. I absolutely love her. She recently moved locations, so it's a little further for me to drive. But for her, I did it. If she wasn't leaving, I would have stayed where she was. But it's a little bit of a better neighborhood where she is. I don't know. She has an accent. She's a very, very petite woman. Very understanding. I mean, you look in her eyes and you can see that she has pain for me. Because I've cried so many times in there, you know? And, I've been seeing her since 2012. It's crazy, all these years. And so I see her every 6 months, okay? And in between, I see the nurse. And she weighs me and then takes my blood pressure. It's always high, and I'm always telling everybody I have white coat syndrome. Some people don't believe in that. I do, because I have a home blood pressure thing that I test myself. So, you know, in case it gives me a bad reading, I do it a couple more times. And so, yeah, so she'll check, you know, make sure I'm okay. And I'll be like, Rana, I'm fine. I promise you. It's white coat syndrome. So, okay. So I see her, you know, in between the doctor, I see her. I did try therapy when they were in the old office. I tried it for a while. The lady was nice, but she wasn't. I almost wanted her to dig into my past. And when I say past, I mean 30 years ago when I was a young child. And then work up to the things that I've been through, because there's a lot. There's a lot of stuff. You know, and that's why I've been writing notes. When I remember something, I write a note. Alright, I gotta be extremely careful about talking about medications with her. I'm on a night pill, okay? I take a night pill because I can't sleep because of pain and just everything. So I've been on that for a while, and it's been successful. But sometimes I'll take it and I could be up all night, even after taking the highest dose. But so I'm on that. I'm on another one they call it an antidepressant, but it helps with headaches. And then there's a second night pill. And then there's vitamin D, which I can say. But it's more expensive at the pharmacy than over the counter. So I take that, and then there's another anti-anxiety. I don't want to name it. So that's 4, 5 5 medications she gives. My doctor, my pain doctor gives me 3 medications, so that's 7 a day, 7 in total a day for psychiatrists. And when I say 7, I mean 7 pills. So that's 14 pills just from pain clinic and psychiatrist. I started seeing a psychiatrist the same month that I started pain management because I knew I had to make a change. I couldn't go on no more. I couldn't. I knew nothing was going to change. I had gone through hell before I even got to pain clinic, let alone everything I went through with pain clinic and getting all the injections and everything. Okay, and then my endocrinology doctor. I met her last year when I was in the hospital for the 7 days, and she just basically, she was, they put different specialists in charge of you when you're at the hospital if you don't have that kind. I mean, my PCP could help me with the diabetes. They were, okay? But she was the real deal. That's all she did was things related to endocrinology. And so she put me, let me say it like this. I remained on the Humalog and the Lantus, but it was raised. My Lantus, and again, Lantus is the one that's slow acting. So you can check your sugar in a half hour. It's not going to really, you're not going to notice anything. The Humalog is the one that you'll notice, but it was a very low number. But I eventually got to like the 30s in the Lantus. Oh gosh. But there's more. There's more. After I was released from the hospital, and she wanted an appointment. I think we did a video chat, and she said in 3 months we'll do a video chat or whatever, an appointment, a follow-up, follow-up from the ER. And this might be a little controversial. I know I just butchered that name. Guys, I'm tired. But I'm also, when I get tired and manic, I'm not I'm not diagnosed with that, but I probably do have it. I just try to laugh about stuff. Anyway, she put me on Mounjaro. Okay, if you don't know what Mounjaro is, it's extremely similar to Ozempic, which was very popular, still popular, hard to get your hands on, and celebrities were getting it just to lose weight. But people like us, it's very difficult to find. I'm on the Mounjaro. I'm on the highest dose now. I started at 0.5 and working my way up for, I think there were 7 pens. I don't know. I'm at the highest dose now. Okay, I've lost about 40 pounds, and that's great because that's probably what's decreasing my blood pressure and giving me better A1C numbers. And my endocrinologist took all those pills, all the Humalog and Lantus. So eventually she took that off when she seen how good the Mounjaro was. And I remember when she said, I'm gonna prescribe you this medication. I had no idea what it was. I don't go around looking like for different pill descriptions. So anyways, she said it was one of the best ones that they have. I guess they have that, Ozempic, and then there's another one. And I will say, and a lot of people have side effects. Well, I have side effects head to toe every day. And thank you, Jesus. This injection is saving my life. Okay, because I could not control my diabetes. I couldn't. In my head, mentally, I thought I could. I thought I was doing great. I was having these shakes and chicken and, but it just wasn't enough. Okay? So now I'm on Mounjaro, and I've been on it for, Jesus, 6 months maybe? Yeah, 6 months. And I remember when I went in to see Rana, the nurse at the psychiatrist, she's like, and I always told her for the last 12 years, do not tell me the number. And what she said was, "Wow, you lost weight." And I've had a little bit of opinions about her. You know, I try to be nice and everything, but the way people say things, I can read right into it. I don't know how, but I just know. But it was the look she gave me, as if I was out there, like, starving myself. She's like, "You lost a lot of weight." And I was like, "I'm on Manjaro. It's for diabetes, and the side effect is you lose weight." And I said, "I'm considered obese, so 40 pounds or whatever I lost. I don't know what I lost to this point, but my clothes are saggy, and um, I have a lot of shirts that I wanted to wear so bad, and they fit, and I'm happy, but I almost feel like it's going to be taken away. You know, I hope not. For mainly, not the weight loss, mainly for my diabetes. It saved my life. This is the first time since 2017 that I haven't had to inject anything except for Monjuro. It's once a week. And it's supposed to have, I think it's like Ozempic, but has maybe one more ingredient than them. People want to compare what's better because they want to lose weight off it. Did I want to lose weight? Yes. Yes, the weight I'm on. I have been on this weight since before my 23-year-old son was born. I kid you not. I kid you not. I was 200 pounds when I delivered him. Yeah, I remember them saying, "Oh, you're about to hit 200 pounds." Well, you know, I knew I was having a baby, so I didn't care. But after that, it was easy to lose weight after the first kid, but after the second and third, yes, it gets difficult. But so you know, I am thrilled that I'm losing weight and my diabetes because I have pain issues, mental issues, things through my PCP, and then endocrinologist. And so the fact that the Monjaro is working so well and I'm not having side effects, I feel like I have a little bit of control over my body because there's nothing I can do about the pain except for what my pain management helps me with. And I have fears all the time that they're either going to just shut down or stop me as a patient. I don't know why. It's a very negative attitude. That goes back to me being prepared and thinking ahead, which I need to stop. So, the point is I have control over my diabetes now, you know? And on top of that, I'm trying to exercise. Whether it's me going to the store, I feel like even if I go to the store, walk all the aisles, it's better than laying in bed doing nothing. I do sit ups 3 to 5 times a day in my room, you know. It usually starts at 10 because I don't want to overwhelm myself. So I blast some loud music and I make myself do those sit ups. And I also have, does anybody remember the Thigh Master? Remember? Well, I have like a knockoff brand from Target. I do that every day. And the reason I do that is I do it on my thighs, obviously, because I start noticing um, my skin getting loose. And I kept thinking, oh no. I should have thought gratitude, but I kept thinking, oh my God, why? Why? When you didn't lose the weight, it looked better. So hopefully, um, guys, I'm 45 years old. 45. I still can't believe it. The point is, you get older and things are harder to combat, and you just have to accept things. And I'm working on that because I'm very negative about myself, and I know that I need to work on that and my self-esteem, because it's not a good way to go about in life. You have to have confidence. I mean, I'm a very good people. I don't judge people. I hear people's case. Somebody could say, oh, XO, whatever, did this, and then he was on drugs, and then he was in rehab. He got better. I'm not going to judge somebody. In fact, I would praise them that they were strong enough to go get help. That's hard. It's hard to get help. But when you're in desperate times, you do what you gotta do. So guys, I'm 45 minutes into this video. I don't know if anybody's gonna even watch it. So I'm gonna let you go, and I don't even know what I'm gonna title this video. But I might film one more. I might. I'm not sure yet. I might. And then I don't want to release them too fast, I kind of want to have some extra ones. Sorry. Just in case I'm having a really bad pain day. Today was bad. I don't even know how I'm sitting here. Okay? It's one of those things that it's a ritual for me now, and I love that. I like that I have a little system going. And I appreciate anybody that is watching this. Even if you watch 5 minutes, you're like, oh shit, I don't go 45 minutes to listen to a woman complain. That's pretty much what I'm doing. So we'll see how things go. When I made those videos years ago, I can't believe it was 8 years ago that I last made YouTube video. And look at me now. You can't get rid of me, guys. So anyways, I hope that everybody has a good journey. Everybody gets the help that they need, and support. I would love for you to subscribe. I would love for it's going to help me get in the algorithm, is what people say. Because it's not about the money or the views. Well, the views tell me. Here's what the views tell me. People watch some of it, and you know what? That's okay. That's okay. So I'm going to go, and I will talk to you soon, and have a wonderful evening.